On this channel, we talk about ways that you can improve your chances of having a life of longevity. Longevity is the idea of living well into your 80s and 90s and beyond, but living healthy, free of chronic diseases, alert, vibrant, and still maintaining the ability to be social and to have a very quality life with your friends and your family. To have a life of longevity, there are many factors that are involved. The first one is going to be genes. Unfortunately, you can't control the genes that you were born with. You got your genes from your mom and your dad, and unfortunately, you're stuck with them. The good news is there are many factors that you can control. The factors you can control are called lifestyle factors, and there are a few, and they're very important. Good examples of lifestyle factors are getting good quality sleep. Very important to get enough sleep and quality sleep. That leads to longevity. Other factors include eating a healthy diet, a colorful diet, one diet full of fresh fruits and vegetables. Another factor is moving your body on a daily basis, making sure that you circulate your blood, get your blood able to transport oxygen into your vital organs like your heart and your lungs and your brain and into your muscles and your joints so that your body can be vitalized. Another important factor is staying away from stress. Now, you can't control the stress that comes at you, but you can definitely control what you do about the stress. We've talked about deep breathing and looking at a bigger picture and also meditating. Today, I'd like to talk about an important lifestyle factor that you can control, and that is how often you see your primary care doctor. Now, we usually see our primary care doctor when we have a problem. Perhaps we have back pain, perhaps we have a problem with our toenails, perhaps we want to know whether we have diabetes, whole host of conditions that take you to your primary care doctor. But there's another kind of visit where the doctor might be calling you in to be seen in the office. Those might be called annual exam or an adult wellness visit. These are important visits where we take a look at how you're doing in that point in time. We will usually ask you to provide blood samples, urine samples, lab tests ahead of the visit. We'll be doing vital signs. We'll be checking your weight. We'll be offering you immunizations, and we'll be offering you tests based on your age that you might be qualifying for screening. Screening tests include tests like a pap smear for cervical cancer, a mammogram for breast cancer, or a blood test to see your risks for prostate cancer. In primary care, we offer these types of visits because most of us primary care doctors don't operate. We don't see patients in the ICU. We don't usually see patients in the ER. We in primary care, we hang our hat on seeing you in our medical clinics. And our goal is to keep you out of the ER, keep you out of the operating room, keep you out of the hospital or the ICU. And we've learned over the years that by monitoring your blood tests, having you get your screening tests, having you do your blood tests and your urine tests, we can predict illnesses before they actually occur. And we can offer you treatments to prevent you actually developing conditions. Let me give you an example. People don't usually become diabetic overnight. We start to see over time blood sugar values start to become abnormal, and they will increase and increase if not controlled. And eventually, if they get beyond a certain point, you become diagnosed with diabetes. And that's when you need medications and perhaps insulin. Of course, we would rather prevent diabetes in you than to have you manage it when you already have full-blown diabetes. And the good news is, if you go to your doctor on a regular visit, you can actually prevent your chances of getting these chronic conditions. Same thing with cancers. If you see your doctor on a regular basis, We can do the best we can to prevent cervical cancer, breast cancer, colon cancer, but that does require you to come to see your doctor and to do the tests that we recommend. I'm Dr. Farouk, and I've been taking care of patients for over 20 years. Many of my patients have been elderly, geriatric type patients. Let me tell you about one of them. We'll call him Mr. Q. Mr. Q used to come to me every time he had back pain, every time he sprained his ankle, every time he was bleeding from someplace, but he never came to see me for routine wellness exams. He never came to see me for annual visits, even though I used to invite him to come to see me when he wasn't necessarily having any symptoms or any concerns. Over the years, he grew to the age where he had passed many years of getting colon cancer screenings. He did not get his annual labs, so we couldn't check his blood test for prostate cancer. We couldn't check his cholesterol. We couldn't check his kidney, liver tests, so on and so forth. And unfortunately, one day he did come to see me, and he was already bleeding. He actually had rectal bleeding. We sent him for an emergent colonoscopy, and it turned out he had thankfully early stages of colon cancer. The moral of the story here is, had he come to see me on a regular basis, and had he gotten some of the tests that we offer him, we could have prevented him from ever getting even the early stages of colon cancer. We would have been able to catch microscopic amounts of bleeding in his stool beforehand, probably offered him a colon cancer screening, and probably would have caught the colon cancer at the earlier stages. Perhaps it would have been a benign polyp at that point. Fortunately, with Mr. Q, we were able to find his cancer early, and he was able to have a procedure where we took out all of his cancer, and he was cured. Good news with Mr. Q, after that, he did come to see me on a regular basis. In fact, he used to come every single year, sometimes twice a year, for blood tests, for immunizations, for any preventative tests that I would recommend for him. He ended up living many years free of diseases. We gave him pneumonia shots. We gave him shots to prevent shingles. We gave him other tests to make sure that he lived a long, healthy life. And he did. He reached into his 80s and 90s. He was healthy. He was free of chronic diseases. He was vibrant. At one of Mr. Q's annual visit, we had noticed that since his previous visit, he had gained 10 pounds of weight. And on that visit, we noticed his blood pressure starting to creep up. His blood pressure was getting just about into the abnormal range. We had a long talk about that, and I said, if you can lose the weight, 10 pounds, your blood pressure will probably go back to what it used to be, which was normal. I decided, instead of waiting a whole year to see him in 3 months, but I told him, make sure that he starts to exercise more and to change his diet so that he can lose the 10 pounds. Sure enough, 3 months later, he came back. He had lost 15 pounds total. And as a result, his blood pressure was back to stone cold normal. This is an example of what we can do when you see your regular doctor on a regular basis and follow our instructions. Because again, we hang our hat on keeping you healthy, happy, a life of longevity, keeping you out of the hospital, out of the ICU, out of the operating room as much as possible. So now it's your turn. My question to you is, when's the last time you saw your primary care doctor? I hope it's been less than a year, and I hope you were able to go for an annual visit where you didn't have any specific problem to discuss, but you were there for preventative medicine. If that hasn't happened in a while, I urge you, please make an appointment with your primary care doctor. Tell them you'd like an annual exam or a regular checkup. You'd like to get your whatever labs you're due for. You'd be interested in any immunizations that you qualify for and any screening tests that you might be due for based on your gender, and based on your age. And if you like this content, please subscribe. And I'd be interested in any topics you'd like to learn more about, because what I like to do is teach people how to stay healthy, happy, alert, and living a life of longevity.